everybody. Welcome back to the Technology Evangelist podcast. I'm Dr. John Fluke, Technology Evangelist, and we're really grateful to be partnering with Medidenta Digital in this endeavor. And today I've got somebody that I'm really excited to talk to, somebody that's not in my age range and is really embracing this whole world of digital dentistry. So it's Dr. Bianca Clark. She practices in Chicago, I believe. Is that right, Bianca?
That is correct.
All right. Well, thank you for joining me.
My pleasure. Thank you for having me. I'm really excited.
Well, Bianca, I always start off with people's origin stories because I think it's fascinating for people to, get the whole take on, like how you got into dentistry and how you got to the point in the profession you are right now. So take as much time as you want. Give me your origin story. I'm all ears.
Well, my dad's a dentist, so there's part of the origin story.
Sure.
But I really didn't grow up working in his practice or anything. Like I would go. Probably one of the worst memories I have is that my cousins and I had devised this game where we decided we were going to ride our bikes. We live on a hill, ride our bikes down the hill with our eyes closed.
Oh,
Because
yeah.
I'm an honorable person, I was the only kid who actually closed their eyes. So, of course, that meant that my head hit a mailbox.
Oh, no.
So, my dad, who's also a dentist, as I said, took me to his office and sutured my head. I don't know why he didn't think to take me to the emergency room. I was probably seriously injured. And it might be why I might be, just a little bit crazy, but I'm over here living like Frankenstein with a sewn head. But I those were probably my earliest childhood memories of being in his practice. But what really sold me on dentistry were when I went to the interviews. The people that I met were overwhelmingly friendly because, full disclosure, in my mind, I wanted to be a radiologist.
Okay.
And I went to medical school interviews and dental. And the people that I met at the dental school interview were so welcoming and so kind and just had such a joy about them and such honest and joyful conversations surrounding dentistry. It really sold me on dentistry. The people is what sold me. And
So what was
then,
you? Oh, go ahead. Go ahead.
oh, I was
Keep
going to
going.
say, and then when I got into when I started kind of getting into like the art of dentistry,
Mhm.
it has allowed me to continue to stay in love with dentistry.
That's really cool. So what was your undergrad degree in?
Biology.
Okay.
Mm-hmm. It's
I
still in the
started out
sciences.
I started out with a chemistry degree that lasted about 6 weeks. And
Oh,
I
wow.
realized that they didn't have the same people teaching the same way in college that they did in high school because my high school chemistry teacher I loved. But anyway, I ended
Mm,
up with a psych degree. So
mm.
had no idea that I'd use that as often as I do with patients. So
Yeah.
do you practice with your dad?
I do not. I do
Okay.
not practice with my dad. Mhm.
So how did you get into private practice then?
So I have it's an interesting story. I finished dental school and obviously I have a DDS, but
Right.
I didn't know what I wanted to do with it.
Right. I get
And
that.
so I decided I was going to do a GPR program, which I did, but I had missed the deadline to enroll. And in true me fashion, I'm like hopping on my computer, like feverishly messaging program directors, being like, hi, you don't know me, but. And so one of the program directors I reached out to said to me, I have a spot if you want it. Can you be in New York in 3 days? So I was like, I'll
Whoa.
make it happen. I'll figure it out. So I called my parents and I was like, so I'm moving to New York. I need you all to come help me pack up my apartment. And that's what we did.
That's amazing. You pulled that off in 3 days.
We
Plus
made it happen.
the the wherewithal to be like, you know what? I'm just throwing caution to the wind and I'm just going to reach out to people that I don't know. Did you ever talk to the program director about that? Just out of curiosity. I'd love to know what his
I
take was.
did. I
Yeah.
did. And she kind of said the same thing. She was like, so I thought you were a little quirky. She's like, but now I definitely know you are a lot quirky.
That's great. So what school did you end up at for the residency?
I went to Monty. So I was at Montefiore in the Bronx.
Okay, so tell me what kind of things did you learn in residency when you were in New York?
Well, what I learned is that dental school does not really truly prepare you for the real world.
Hmm.
I think that we finish dental school and we get really excited about like seeing patients and treating patients, but don't truly have an understanding of what that actually means. We have the unique privilege of patients coming to us kind of already being vetted by the school and knowing how things work versus in the real world where people are honestly coming to you for your expert opinion. You have become the subject matter expert on all things dental. And so when you're thrust into that world, it really kind of is a jolt to your system, but I think it does impact on you how actually important this career is. And so, what I really learned was the importance, one, of staying really relevant with continuing education, because the questions that people have really come from a place of lack of understanding. So, having an empathetic ear and understanding the importance of staying abreast of what's current is truly important. So that's kind of what residency taught me was, one, I didn't know anything, and
Right.
two, the importance of staying in the know.
It's interesting because I really and so when I graduated, everything was paper and there was
Yeah.
no internet. And I opened an office and I had to try and figure everything out by myself. And
That's
that was
tough.
horrible. Um,
Not horrible.
Well, I managed to figure it out, which was good, but
Yes.
it was tough. And one of the things that I learned early on in my career is when my wife was pregnant with our first child, and I went to one of the visits with her,
Mhm.
and my wife is a list maker, so she'd always go to see the doctor, and she'd always like have a note with some questions that she wanted to ask. And,
Mhm.
and she asked a question, and doctor was probably, I don't know. I mean, we were young. Doctor was probably in his 50s. And he kind of leaned back and he said, "That's a good question. I don't know the answer to that." And
Mm.
then he said, "But you know what? I'll get the answer for you."
Yeah.
And like this big shaft of light came down, and I was like, okay, here's this guy that's been at this for a really long time. He's really good at what he does. And he had the confidence to say, "You know what? I don't know."
Yeah.
And that really was like a life-changing moment for me because I kind of felt like you said, I needed to be the subject matter expert and I had to know everything. And I learned from that, obviously, that I could tell patients, that's a great question. I don't know, but I'll get the answer.
Find out. Yep.
Yep.
Mhm.
And having that passion for learning is kind of what, ties that back together because you're a continual student. I think when we get out of school, we probably know the basics
Yeah.
really well. But
Mhm.
so few of our patients, when we're actually seeing them, ourselves, are basic.
Yeah.
There's all these other factors that you've
Yeah.
got to take into consideration. And
And dentistry's gotten more complex,
yeah,
now that we understand systemic conditions and oral biomes and, that your oral cavity is the gateway to your entire system. So we have come into a unique space where not only is there so much to know, now there's even more.
yeah, I like this story. I've told it before, but when I went to school, there was a lady that worked at the school in the administration, and she was a cartoonist, and she loved to draw. And she had this picture that they would sometimes even show in lectures, and it was two people in a dental chair, and one of them had this huge mouth and this little tiny body,
Okay.
and under it it said how dentists view people, and then next
Mm.
to it was a huge body and a little tiny head, and it said how physicians see people.
Mhm.
And that has changed so much
Yeah.
in the last, 10, 20 years,
Oh,
probably.
yeah.
It's really, really amazing.
Yeah, you look at sleep medicine, I collaborate with my patients who have really complex medical stories. And I don't say histories, I call them stories. But
Right.
I collaborate with my patients' primary care physician, their cardiologist, if they have any level of rheumatology needs. Like I really try to be encompassing of treating them as a whole.
Yeah, that's real important. I forgot to ask, are you a general dentist?
I am.
Okay, me too. No, that's really cool because it does what I love about it. It is basically what you just said. It allows you to do the whole scope of things.
Yeah.
And I like to tinker and I get bored. So I think if I had ever been, forced to kind of limit myself into something, I don't think I probably would have enjoyed that as much as
Hmm.
what I'm doing now.
Yeah. Yeah.
So tell me about your embracing of the whole digital process and how you got to that.
So, just going back to being a lifelong learner, I have the incredible opportunity to have a ton of friends who are dentists as well. We not only commiserate, but we collaborate on cases. But one of the ways that because we don't all live in the same city anymore, one of the
Mhm.
ways that we kind of convene is that we talk about like what CE courses we want to take.
Yeah.
And so one of my good friends, Dr. Arthi Jagadar, was like, come do these digital design courses with me. And I was like, I don't want to do that. Like, I signed up for COIS. I don't know if you know kind of like how it is to sign up for COIS and that
Yeah.
like you sign up for a course, but it's like 2 years later before you can take it.
Yep.
So I was like, I've got course on the docket, like that's coming around for me. I really don't know if I want to like add anything else to my plate. But she was like, just come, let's just see what it is. And I was like, okay. So we ended up going down to the Mod Institute in Charleston.
Okay.
And I fell in love because I was like, I could immediately see the value add that I could bring to my partner and I's offices,
Hmm.
like where it would immediately fill in like some of the gaps that we had in the care that we could provide for patients. That is a dog, that's not me. But
Fair.
I'm not a ventriloquist.
Fun at parties. Amaze your friends.
Right?
Yeah.
Get your teeth fixed while I throw my voice.
Yes. Love it.
But it really ignited in me just this curiosity around digital dentistry because I feel like it is such a powerful tool. And part of what makes it powerful is that you have the ability to harness it however you want. It doesn't mean you don't have to do digital design yourself to do digital dentistry. And the companies that are involved in like kind of disrupting this, and even the instructors who are involved in disrupting this, have done it in such a way that it allows all of us to practice where we feel comfortable. Everybody doesn't want to, work with exocad or 3Shape or any of that, but there's an opportunity for you to still be able to participate in this movement.
Yeah. That's absolutely true. And that's a great point because I think sometimes our colleagues, when they think of doing things digital, they think of a wholesale change. I've got to step off of this cliff.
Right.
And, once I start, I can't stop. I can't go back or whatever. And one of the things that I want people to know is that you can just stick your toe in the water and do as little of it
Yep.
or as much as you want. I tend
Yep.
to think that if you stick your toe in the water before long,
Oh, your
you're
whole
going to
body's
be
going in.
swimming.
Yeah. It's gonna
Yeah.
happen.
But you don't have to make this, like I said, wholesale change where, oh my gosh, it's not only a disruption to the industry, now it's a disruption to my practice and my
Hmm.
workflow. But in reality, you can do as little or as much as you want. How did you start in that process?
So I started with annoying my business partner and being like, we've got to get a printer.
Uh, real quick, is your business partner male or female? I'm just curious.
Mail.
Okay,
Hmm.
cool.
And so and even today, he's just kind of like, it's just not his thing,
Hmm.
which works.
Yeah.
But he still uses it. It's not his thing, but he still uses it
Yeah.
because he doesn't want to do the design stuff.
Okay.
Um, but I say all that to say I got started by, after I took the courses, it was like, I got to get a printer, I got to get rolling. And to be honest, like once I had in my mind how I was going to implement this into my practice, getting it started, it took a day. And I talk about this probably at an annoying pace. and an annoying amount of times because like my husband and I set up my printer over the weekend and like my team and I were printing on Monday. And if that is not like a true testament to how easy this, even like you said, dipping your toe in, how
Right.
easy it is, it's just, I mean, it becomes a no-brainer, at least in my mind, it becomes a no-brainer.
Now see, I think that's super cool because it's not like you graduated college with an engineering degree and you
Mhm.
think, along an engineering line. Although I will say that there is so much engineering in dentistry that you've got to basically, even if you don't realize you're an engineer, we all kind of are.
Oh, yeah.
Um, but you came out with a bio degree, you went into residency, and what you realized, I think it was Jean-Paul Sartre who said, "All I know is that I know nothing," or something like
Yes.
that.
Uh-huh.
And,
Yep.
and so you said, "I got to learn." And then a friend of yours said, "Hey, let's go do this thing." And you were kind of, yeah, okay, what the heck, And I want to tell you, Bianca, so much of my life and my life changing events have been the times where I've said, like, "Oh, all right, what the heck,"
Yeah.
and then things change. But so you went to that and you were like, "Okay, this seems kind of fun. Kind of think maybe I could get into this a little bit." And so you bought a printer and
Yep.
you and your husband set it up and you had success day one.
Day one. Rocking and rolling.
That
Yep.
is so cool. Do you remember what your first case or what your first few cases were?
So started off small with just removables, just doing
Mhm.
night guards, retainers, something
Right.
super easy. My team was able to start going solo with that incredibly quickly. Like they enjoyed it. It's been a great value add for my team and for the practices as well. But got started with that. And then, of course, what happens? You dip your toe in and then you want to put two more toes. So then I
Yeah.
was like, well, what else can I do? I took these
Right.
courses. I actually ended up taking, we have three doctors that work with us. We have three associates. We took
Okay.
them as well because I'm like, maybe they will get something out of this too. Even if it's just a, the beautiful thing about design is it really creates in you a curiosity, but it
Uh-huh.
also creates in you the unique opportunity to kind of see something and say, oh, so this might be why that case didn't work out because I had this going on. So, when you break it down to the design elements, you really have the great chance to see, like, okay, well, maybe that was a failure because I didn't engineer this the right way.
100%.
And
100%.
it kind of made me reverse engineer dentistry in the way I
Yeah.
was practicing, which then full circle moment made me even more curious. So then I dipped my foot in. So I was like, well, what else can I print? So then I started doing like inlays and onlays. And, yesterday I had a case for a patient who she's getting an implant supported bridge from 6 to 8.
Mhm.
So printed that for her
Mhm.
temporary. And then because 9 and 10 looked a little wonky, I 3D printed crowns for 9 and 10 just so she could kind of test drive it and see what it looks like. The
Yep.
definitive is going to be one of the newer generations of zirconia. But like I remember having days in practice where that case would have come across me. I'd have been like, oh my God, I got to make a suck down. Like, how am I going to temporize this? Let me call the lab. Let me see if the lab can have her come over. And I don't have to worry about any of that stuff.
You know, See, that's what people need to know is, and you made a couple of great points. I always say that I've never met a dental assistant in my career when you say, "What's your favorite thing to do in the office?" That they say, "Trimming models," you know, or pouring models, or
Yeah,
running
yeah.
the suck down machine, or dropping something and throwing powder all over my scrubs.
Yeah.
Um, and or yay, more alginate, to
Yes.
mix. And then the thing that I really found when we started doing this is that when you get the team involved, they like it
Yeah.
and it's fun for them. And we all know that probably since COVID, it's been really hard to find good team members.
Yeah.
I mean,
Yeah.
the way the world is now, and with the way, some of the wages are at places like, I feel like sometimes we compete against like a checkout position at Target.
Yeah. Yeah.
Um, and I love when we do something like this, and because I've got the team spun up to do things, I'll actually go into the room, when we do the delivery, and I'll check it and everything, and then I'll say, "Hey, did she tell you that she made this?" And
Yeah.
patients will look and they're like, "You made this?" And I feel really blessed because I've got really humble people that work with me, but they'll all kind of like look at the floor and kick their
Yeah.
foot
Yeah.
and then go, "Yeah, yeah, I did that." And the patients just think that's the coolest thing ever.
Yeah.
And I think when you turn the team loose and you let them do things like that and you let them get that emotional reward for it, then being a checker at Target doesn't really hold, that
Same thing.
same
Yeah.
fascination for another
Mhm.
buck an hour
Yeah.
or whatever it is. Do you feel that same way too?
I totally do. And it speaks to how important it is to have reason and how important it is to have culture. And
Hmm.
like, we all come to the table with some level of hierarchy of needs. You
Right.
have to be able to meet those needs for your team. And keeping people curious and engaged is one of the best ways to help someone get to self-actualization. It's just what it is. So when you throw something someone's way and they catch it and then they turn around and they turn it into something else, like my team will design night guards and just like make funky designs on them. And they love
Right.
it. That's like their little thing they do. We're not delivering the ones that, have long canines that look like
Yeah.
vampire
Yeah.
teeth, but it's fun for them, and even for this Halloween, like we're gonna be for patients who want to come in and get some funky teeth, like letting them do a little design if they want, print some funky teeth for patients. It's something cool and fun, and it just breaks up some of the monotony of the day and gives them something that is theirs that they made that they can either take home or take pictures of or just be excited about.
You know, okay, I got to ask you because you just used a whole lot of psych terms in that little paragraph, and you're a biology major. So I got to ask, where did you get all of that knowledge? Because that was beautiful what you just said. It really
You.
was.
Well, it is to no credit of my own, but I have been surrounded by people that constantly push me to be better, and not just professionally, but personally, always reminding me how important personal growth is. So, like we are always, "Hey, did you read this book? You should check this out. Are you listening to this podcast? Huberman's got a book coming out. Make sure you get the book." Like
Yep.
we're constantly exchanging ideas on how to just continually grow and develop as people. So, professional growth is extremely important to me, but never letting the personal aspect of that fall by the wayside either.
You know, we hear the word burnout a lot in dentistry.
Yeah.
And I will put $100 on the table right now and say that Bianca Clark is not going to burn out
you know,
because,
I was talking to my partner, one of our assistants, and or one of our team members, and we were just saying like what we would do if we won the lottery.
yeah,
And I was like, "Oh, I'd still come to work." Like
yep,
I still,
yep.
hands up, hands down, like I still find dentistry so exciting.
Yeah. I've always said that if I hit it big, I would practice and I just charge a lot less, you
Yes.
know,
Yeah.
because, why not? Those people were with me beforehand. And if I can do something like that, then why not? I couldn't do
Yeah.
it for free. So if you put a sign that says free dentistry, you're never, you're never going to get to the end of the line. But yeah, I mean, I just love that philosophy because it's keeping yourself excited and keeping yourself enthused about this. And that's one of the reasons that I'm always harping on digital stuff is that, I mean, I'm not an engineer. And I'm not that smart. I've figured it out. And no matter where you are in your career path, I mean, I've had people say to me, "Oh, I'm going to retire in 5 years, so I don't want to invest in X because, it's only, I'm just going to do the same thing for the next 5 years. And I'm like, why would you?
Yeah.
Why wouldn't you, 6 months from leaving, want to learn or try something new? I mean,
Yeah.
you know, you
Yeah.
got to have that passion. And you obviously have that passion, which I think is super cool.
Well, thank you.
So, what do you use to design with? What softwares are you using?
So I'm using Exocad.
Okay, great choice.
But before I got Exocad, I was using Medit and just kind of playing around with
Mhm.
Medit and some of the functionality of it. We've got two printers. I was using, I mean, anything that I could find a back door to figure it out. I was like, okay, let me see if I could do something with this. Like, let me see if I can turn this into something else. So before I took the deep dive into Exocad, I was still designing. I just was using some of the backdoor methods.
I love that. That's a software word, and I love that. So you're using open systems, I take it.
Yes.
Okay,
Mhm.
yeah, I love that. I love choices. I love, hey, there's this new thing. I wonder how that works.
Yeah.
And putting that in. What printers do you have? What models? Or do you
So
know? It's no big deal if you don't.
I have the Lux Creo Glidewell Fast Print,
Okay, yeah,
and that's the one I primarily use. And then our other location has a Sprint Ray. I
okay.
can't remember if we have a 95 or a 55. But just to your point about the open systems, what I have also found, which I feel like is extremely unique, and I
Hmm.
don't know, I find it to be unique to the 3D printing realm for dentistry is
Yeah.
that if there's something I'm interested in, like I've reached out to Pactent so many times about like, hey, can we get a resin that does X, Y, and Z? And they've been like, you
Mhm.
know what? We'll think about it. Like, let's get to the drawing board and we'll circle back to you. And having, like you said, those open systems has really created an avenue where we can reach out to these companies and say,
Mhm.
we're leaving this on the table. Like, how do we bring this for us? Like, how do we make this scalable so that we can all kind of have access to this resource? And the companies have been nothing but positive, nothing but gracious and like listening to me and my thoughts and my ideas about things.
See, that's awesome. Obviously, I'm a Pac Dent fan.
Yes.
Got rodents stacked all over the place here. And one of the things I love about them is that it's not just like, okay, we made this stuff, it works pretty well. Um, Now we're off in some other direction. We're looking at some other thing to do. I mean, they
Yeah.
just keep innovating and they just keep putting better and better stuff together and they never rest on their laurels.
Yeah.
And I love the fact that you said, you can call them and you talk to them and
Mhm.
they listen to you because I mean that's a huge, huge thing. We're all in this together,
Yeah.
whether you're the CEO of some dental supply company or you're a dental assistant or whatever, the patient is always, the one that pays everybody's bills.
Mhm.
And it's all about making it better for the patients.
Yeah.
I mean, it
Yeah.
really truly is. And companies that listen and don't have excuses on why you can't, or why they can't get you, whatever innovation it is. I I just don't think that's smart business.
It's not. And it's also, you know, I have a case where the patient's doing like a lot of fixed work and
Hmm.
very sweet lady, super nice. She's missing a few of her premolars, and we all know what a shortened dental arch can lead to.
Yep.
So I told her, I said, you know what? You're investing in all these other things. Let's let me print you a partial.
Hmm.
You know, you don't worry about paying for it. I'll print you a partial. But I can do that because it doesn't cost me a ton of money.
Right.
Like I don't have to take this on the chin. I can comfortably say to a patient, let me give you this. You're investing in so much other stuff. This is going to make sure that the other things that we're doing have a high chance of survival. And we've never had that in dentistry. We've had to contend with, well, let me call the lab and see if they'll do this for a discount, or
Right.
if something breaks, what's the warranty on the it completely eliminates that pain point. And I mean, that has been such another value add for me because like I can have a conversation with a patient and not worry about like, am I going to be eating $1,000 lab bill?
Yeah. Yeah. And it's funny, you mentioned before we really started recording that you have a puppy and you have a 3-year-old dog. And, I think it's funny and kind of sad in a way, but how many dental appliances get eaten by pets?
Yeah,
People
all the
come in, "Oh,
time.
I lost my retainer," or "The dog got a hold of my denture." And when you've got a digital file, if something like that happens and it hasn't been too long, you just you just push the print button and
Push
tell
the
them, "Okay,
button.
come by tomorrow," or whenever, and
Yeah,
just pick it up. We don't even need to
yeah,
necessarily see you. I mean, what a great service, I mean,
yeah.
in the analog world, I've had more than one person over the years drop a denture and break it.
Mhm,
And then it's
mhm.
like, okay, now we're back to I can't even remember how many appointments it took, 4, 5, 6, and meanwhile, you're trying to get by without a smile,
Yeah,
which is horrible. And I
yeah,
mean, even just having that option. I've got a friend of mine that actually, when he does a lot of dentures, and when he does them, he just prints a spare and
yeah.
gives it to the patient. And he's like,
Why
here,
not?
anything goes wrong? Yeah, I love that. Yeah, why not?
What
Mhm.
it doesn't cost you much.
No,
It's such a great service for our patients.
it is. It is. So tell me a little bit about the resins you're using. What are your favorite resins?
Ooh, I'm a big I do a lot of my patients have a pretty extensive dental story.
Hmm.
So I see a lot of MODs where somebody didn't take out the entire MOD, but just took
Right.
out the MO part and then added their MO. So I see
Right.
patchwork dentistry.
Yeah.
And I love Sculpture 2.0 because I can say to a patient, you know what, we can keep this really conservative for you. And
I'm looking. There it is. I knew I had it here somewhere, Bianca.
I can keep this really conservative for you. And the reality is nothing lasts forever.
Right.
Like, I don't know who thought up composites. I'm sure I can find out. But to create something that has to be kept dry and the wettest place on our body is just like what, what who sat in their bed and was like, how can I make life hell for somebody else?
Yep.
But, I can have a conversation with my patients and say, listen, we can keep this conservative because what science tells us and what I know is that I can provide you a replacement for what you're missing, but I can't provide you something that's going to feel or behave exactly the same.
Right.
So, keeping the most amount of your tooth structure is important for me. It should be important to you. Here are the whys, because the why is always important.
Hmm.
I can remove what's there, keep it extremely conservative, put another filling in that has a matrix in it that'll give it some longevity. And hopefully, if you have to have this conversation with another provider, if you're still seeing me in the next 7 to 10 years, and we say we're starting to see some marginal breakdown, you still have enough tooth that we can pivot to something else. I'm
You
not
know,
telling you you need a crown because you have a big
right.
filling. I hated that.
Yeah. Well, and I never understood the logic. And don't get me wrong, I'm not preaching because I've done it. But you would have a patient come in with, like a molar with an amalgam cusp replacement, you know,
Right.
and then they would fracture that amalgam and maybe take a little bit more tooth with it. And so we would go in and we grind down the other three healthy cusps,
Yep, that are
you
still
know,
good.
to
Mhm.
replace the one that's missing. And I always thought that was kind of a weird thing, that we're going in and we're taking away 75% of the healthy tooth structure to fix the 25%, that needs to be fixed. And
Yeah.
when you can do this and print it economically, you can be more conservative. There's no
Yeah.
reason to have to go in there and waylay cusps just because you do. I mean, that's just
Yeah.
you know and you said something a while back when you were talking about one of your first, or I think it was a case you just did recently, but anyway, you talked about this lady, and it was the implant supported bridge, and you had the other teeth with it, and you were talking about what, in the old days, what would I do? I call the lab, and you said you can let them try them out, see what they think. And that piece of it is huge, because
Yeah.
everybody that does either a full mouth or a full arch of fixed, there are, multiple ways to try and reestablish CR and CO.
Mhm.
But the only problem is none of them work 100% of the time. And
Mhm.
so if you can print something and then tell the patient, here's the deal. So I'm a Midwest Catholic guy. So
Oh,
I
where are
like to
you
call this,
from?
I'm down in Kansas City.
Okay. Are you
Yeah,
from Kansas City?
I am. I am. I've
Nice.
been here my whole life. And
Love
the best
that.
thing about Kansas City is it's a short flight to Chicago. So
Come on by.
I will. But anyway, I make a joke with my patients and I tell them these are purgatory restorations. I say they're not
Yeah.
temporaries, but I can't look you in the eye and tell you with 100%, certainty that it's permanent. It's kind of in that area somewhere in between. They're in purgatory.
Yeah.
But when you can put something like that in the mouth and know, like, okay, I'm going to finish this in zirconia, but
Yeah.
I may finish it in a month. I may finish it in 6 months. Try these out. You can smile, you can chew, you
Yeah.
can do everything that you can do. And if they come back in and they're like, you know what? It's not working. I'm closing too far, I'm closing too open, or something's going on. And you can fix that
Yeah.
and then dial it in perfectly and then just rescan what you've got and
Yep.
then let the lab create that in zirconia. And because I'll confess, at least twice in my career, I've cut that kind of stuff off because
Yeah.
it didn't work.
And
And
that's
that's,
heartbreaking.
oh my gosh. I mean, it's hard. The
It's
patients don't
chair
enjoy
time.
it.
Yep.
Yeah, I
And
sure
they've
don't
lost
enjoy it.
trust.
Yeah,
They've lost trust
exactly.
in you. Mhm.
And so when you can use this to work out the bugs ahead of time and leave yourself a back door to
Mhm.
correct it. Same with aesthetics, we've all done cases where you look at it and you put it in and the patient's happy with it and you're happy with it and it's a great day, and then a couple weeks later they're on the schedule and they say, if that could just be a little more round right there,
Mhm.
and I think that maybe this is just a little long right here. And I'm happy to do it, but then I'm beating up the permanent restorations. It'd be so nice to do that in something that was completely adjustable. And then once
Right.
again, they wear it for a while. They're like, I love this. Bingo. You're going to get exactly what you've got right now. It's just going to feel different when it gets.
Yep. Yep.
And I love that. So I'm glad you brought that up because
Yeah.
that's so critical to this whole thing.
Yeah.
So
And
go
and
ahead.
it's a place of where you can practice in a way that's comfortable.
Mhm.
You've removed the guesswork. Like,
Yes.
why not? Why tell me someone on this planet who would not want to work in such a way where you have a level of predictability that keeps you from not sleeping at night. I had many sleepless nights as a dentist,
Mhm.
like agonizing over a case, hoping something had, wishing something had gone differently, wishing I had done this instead of this and this instead of this. And it's like you get to completely remove that. Like you can practice dentistry and not have to worry about it. That's amazing.
I will fess up and tell you that I probably lost conservatively, I would say if you added up all the hours that I spent either awake or waking up in the middle of the night or sitting worrying and thinking about some treatment, I literally have lost months of my life
Oh
doing
yeah.
it.
Oh yeah.
And that's one of the things that I always try and tell younger doctors is like, if I can, I wish I could just like wave a magic wand to make it happen. But I'm like, if there's a way for you to not lose those times,
Yeah.
to stress and worry, man, I would do that for people in a heartbeat. And
Yeah.
this is a great way to do that.
Yeah.
It really
Because it
is.
weighs on you.
It does.
It's a weight. It's a heavy weight because we get into this career because we want to help people, we want to make change, we want to be impactful, we want to be positive. And if you feel like you're not able to do that, it's crushing.
Yeah, it is. We put such a weight on ourselves. We're working in an imperfect environment with
Mhm.
imperfect beings,
Mm-hmm.
And what we want when we like put our hands up and walk away is now it's perfect.
Right.
And that's a recipe for stress, right?
Yeah.
I mean,
And burnout.
yeah, yeah,
Mm-hmm.
absolutely. You think about how many people, drive themselves out of the profession because of that. The
Yeah.
numbers are, not small for the
No.
people that are just like, I just don't want to deal with it anymore.
Yeah.
Gosh, I love what I do. I mean, it's all I've ever wanted to do from the time I was 3. I pulled my sister's baby tooth when I was 3.
Did you have gloves though?
I did not. Here's here's a little thing that'll scare you, Bianca. For my first 2 years in the clinic, because we started in at UMKC, we started doing prophies. I want to say maybe the first semester, for sure the second semester. I did 2 years with no gloves.
Oh my gosh.
Yeah,
And you still have fingers.
I do still have fingers. I do. And it was so funny because I can actually remember, we'll get in the Wayback Machine here. They had an all school meeting. They packed us
Mhm.
all into this lecture hall and they said, look, there's some bug. We don't know what it is. We don't know how, where it came from, but it's killing people,
Mm,
and the only way we can, protect ourselves is we've got to implement all of these, you know,
safety measures
precautions.
and yeah.
And yeah, and it was gloves, and
No.
we didn't autoclave handpieces for those 2 years.
Really?
Yeah.
That I did not know.
Yeah. In fact, the really
Wow.
funny thing is that when I graduated from dental school, when graduates went out and looked for a practice to work in or a practice to buy, usually the first question you ask is, do you have an autoclave? Because a
Wow.
lot of offices didn't even have an autoclave. Everything was soaked cold.
That's
And
crazy.
yeah, I mean,
Yeah.
look how much it's changed. Now we're talking about, doing teeth in a day and,
Yep.
spinning things around on a screen and all
Yeah.
that kind of stuff. So I'm really
Yeah.
showing my age. I apologize for that. I sound like my grandpa.
No, you're only 17. What do you mean? You've been practicing since you were 3.
I feel like I'm 25, if that helps. So.
That does.
So let's talk about some of the other resins. You mentioned Sculpture 2.0. Anything else
Mhm.
that you're really passionate about?
I love using I got a little bit creative with using like aligner resins for
Hmm.
partials.
Okay.
I use the denture base 2.0, like if I'm doing something that's an immediate extraction and delivery, like
Right.
the Kois scan body, just like we did. I don't know if you're familiar with K-pop Demon Hunters.
I am not. I know K-pop, but I don't know anything about the Demon Hunters. So
It's
enlighten me.
it's all the rage right now. It's a cartoon movie on Netflix
Okay.
about these pop stars that are actually demon hunters.
Okay.
But a lot of the kids are the characters from that show for Halloween. So we got a little creative with printing some of the little tools that they used to,
Yeah.
I guess, vanquish the demons.
Right.
But really my heart lies with I use the surgical guide resin. Sculpture 2.0 is my big wheelhouse, honestly. That's my heavy hitter.
That's really cool. How
Hmm.
much do you think now do you still send to a lab?
Um, you know, I will say I send I would say about the same,
Okay.
honestly.
Yeah, no,
But
that's
the
fair.
difference is that I'm able to recapture more dentistry that otherwise
Hmm.
I would not have treated. Like I can practice in a more proactive way because
Right.
I can still be conservative and I can feel comfortable with things. So I still am a big supporter of labs and I still use my lab, but because I can comfortably tell patients, now we have something that we can provide you that gives you an intermediary step before we talk
Right.
about crowns for you. So I've just still send the same amount to the lab, but I'm capturing more dentistry. because I have something I can give them.
No, I love that. And one of the things that I hear from people frequently is this is going to, this is going to drive the labs out of business. And
No.
no, I don't believe that at all either. You know, there's always going to be a place for people that are so good at that aspect of things. And one of the other I've told this story before, but I think it's interesting because Toys R Us did an ad and they said, you know what, we're going to just use AI and we're going to AI generate an entire commercial. And in the commercial, they did have some people. And when they released that ad, they got a lot of pushback where people said, I don't know what you did, but the actors look creepy. There's something about them. Oh, that's awesome.
I don't know. I know I'm sorry about having to come off the screen, but
No, that's okay. We are pet friendly here on the Technology
this
Evangelist. So
is the boy.
oh, he's gorgeous.
Thank you.
But
They had these weird AI people.
yeah, and so my big thing is I don't know if it'll ever happen, but I
No.
don't think anytime soon a machine is going to be able to generate what I call the soul. And
No.
what I mean by that is that there's a certain thing that humans impart into things. And
Yeah.
I do think like aesthetic dentistry is one of them. When you're trying to match that, single number 8 to the surrounding dentition, or, you're
Yeah.
trying to, match 8 and 9 to the surrounding dentition, you're going to need somebody that's got that talent to do
Yeah.
that.
Yeah.
And I think it's cool that you brought up the fact that you've got this way now to actually help more people and help people
Yeah.
in better ways. Um, and you're not sending or you're not doing everything in house. You don't have
Yeah.
that. You've still got the lab. I think that's incredibly important.
Yeah. And I think about like all the years of, well, it doesn't look very good, but it's not horrible. It's still kind of working for you.
Right.
You know, if it starts to break down even more, we'll have to do a crown. Like I don't
Hmm.
have those conversations anymore. I see something, the margins look funky. Let's
Yeah.
be proactive about it and take care of it now. Let's not wait until the tooth is symptomatic. Let's not wait until, it completely just disintegrates. Let's
Right.
take care of it now, and it can still be conservative. You still have your tooth. Like I love having those conversations with patients because the first thing they say is, "Oh, well, wait, you can print fillings?" And I'm like, "Yes. Yes, we can." And this is great because had this been, 5 years ago, we would be saying, or at least I would be saying, well, you have this really big filling. I see someone's tried to fix it a couple of times. It doesn't look great. The integrity of the margins is not the best. But if we take it out and replace it, you're going to lose most of your tooth. So, it's going to kind of wrap around. So we've got to do
Yeah.
a crown.
Yeah. There's nothing. I always tell patients there's nothing as good as what God put in there at the factory. You know,
Truth.
I'm
Yes.
I'm good sometimes, but but
catch,
but I'm not
catch
a
me on a
deity.
Tuesday.
Yeah, exactly. And not in this situation. One of the other things you brought up that I thought was cool, and I want to go back and revisit, is you talked about when you design and when you're engineering these things, that oftentimes, if something doesn't work, you're like, oh, that's what it was. I didn't
Hmm.
design it right, or whatever it is. And I think doing that and being able to, as you're doing, follow that process all the way through on these cases, it makes you better,
Oh,
at
yeah.
what you do. It helps you understand. I remember being in dental school and they were making us wax things up. And I was like, I am never going to do this in my career. What am I doing this for? And then when I got out, I realized, oh my gosh, if they wouldn't have done that, I'd have had no idea about, how difficult
Yep.
this area would be for a lab, or whatever.
Hmm.
And I think it's a great teaching tool for the doctor who's actually doing it, where you
Yeah.
realize, I mean, scanning makes your preps better.
Oh,
Um,
yeah.
when you've got to blow them up and look them on the screen 30 times magnified, and you're like, oh, no, I can't read that, or that's not going to work.
Yep.
Or like you said, you have a failure and you realize, oh, I didn't take in the fact that the occlusion is off somewhere or whatever, and that's what happened. I think it just
Yep.
helps you be better at what you do and provide better dentistry for your patients.
It does.
Yeah.
And the other part that I love about it is if I print something and I'm not happy with it, I just reprint it.
Mhm.
Like, I'm not
Yeah.
I'm not stuck with like wondering, and it's very real to know that what we do, everything is not going to be successful.
Right.
But, to be able to say to your patient, you know what, I don't love this. I can do better. Let me fix this for you. And you don't have to come back and see me in 2 weeks. We can take care of
Right.
it now.
Yeah. Love that. You know, and one of the other things you said that I want to revisit too is you talked about, bleaching trays and occlusal guards and things like that. I think it's important for doctors that are either just getting into this or thinking about it is pick off that low hanging fruit.
Yep.
Your dental
Start
assistants really
small.
don't want to trim models.
Yep.
And a lot of us are doing, lots of bleaching and lots of occlusal guards. And if you just start with that, the simple stuff where AI really does most of that design for you,
Yep.
and then of course you can edit it if you want to. But, why should somebody wait 2 or 3 weeks for an appliance
Yeah.
if they can
Especially
have it
now.
today? Yeah, tomorrow, whatever.
Yeah.
I call that when I don't do it and give it to them same appointment, I call it just in time dentistry because it's like
I like that.
I stole it from, I think it's Toyota in Japan that came up with the idea of like, if they figure out that we're going to make 100 cars today, they don't have a huge inventory of tires. They actually have where like 400 tires pull up at the factory in a truck that morning. And then every one of those tires gets used, and they call that just in time delivery. So I stole that.
Mm.
But I do think it's a great way to do things. If I can't do it, if I can't give it to you today, if it's late in the day, then I give it to you tomorrow.
Yeah.
But it's, you're still not waiting those 2 to 3 weeks, and people love that.
People love it. Patients love it. They do.
Yeah.
And the team loves it because you've removed the anxiety of like, okay, well, now I've got to figure out where this case is. Like we've taken off some of the workload from our team as well because they're not tracking down cases. They're not wondering where stuff is. It's out of our hands now. It's done.
Yeah.
And
You
there's,
have that morning huddle, and it's like, oh, wait a minute, Mrs. Jones is coming in at 1 o'clock. Is her crown back?
yeah.
Or
Mhm.
whatever, yeah, it's there because we made it.
Yeah. Yeah. And they have, there is a beauty in finality. So being able to complete
Love.
something is important.
Yeah. Oh, I love that. Bianca, thank you so much
Thank
for
you.
this.
Thank you, especially
Yeah.
with me contending with
Hold him up one more time before we go, because
this
I can tell you're scratching him.
this crazy boy who has all of a sudden decided that not only is it important to not leave me alone, but to also
Oh.
eat the carpet while he has toys abound. All
Oh,
of these things, but they're never good enough in the moment.
right. Now, I was doing a webinar once, and Zcat jumped up on the desk and really stuck his face like right up in the camera. It was like this big nose. And he was like, what's in it? What are you looking at? What's in there? And I was humiliated. The people that were attending actually thought it was pretty doggone funny. But what was it that I think W.C. Field said? Never work with kids and dogs.
Oh, yeah. Yeah. Yeah, yeah. Well,
And it's so true.
I've had him with me before, and the last time I had to do a conversation like this, I put him upstairs, but he screamed the entire time.
Mm.
So I was like, "Oh, I can't do that."
Yeah. No, it's funny. The doors here behind me are usually opened because when I'm doing something like this, if they're closed, then Z just comes over and he sits up like a prairie dog and then just starts beating on the door with them. I'm lucky he's got soft paws, but it's
Let
like
me
bam,
in,
bam,
let me
bam, bam,
in.
bam, bam. Yeah. So I just learned leave him open. If he wanders in, he wanders in. I'll just deal
Yeah.
with it when he shows
Yeah.
up. Hey,
But
how can people find you if they
so
want to talk to you about anything? Are you open to telling us?
Of course, I'm always open to sharing, and I
Cool.
will say that about dentistry in general. I love that it's become like such a global collaborative space. Like when I didn't graduate like, a million years ago. It was relatively, I graduated in 2010, and I feel like even then dentistry was such an isolated place.
Yep.
We have seen that shift so much. Like people are so willing to be open and honest and share their real experiences that it's just become such a beautiful place to be. But I say all that to say, long story long, I'm on Instagram. My Instagram handle is MSEDDDS.
Okay.
I can be reached on email at drbclark at smilestudiochicago.com.
That is awesome. Do you do any lecturing just out of curiosity? Because you've got a great passion.
A little bit, a little bit. I've
Okay.
spoken at IOX with Glidewell. I'll be in Glidewell 3 times next year. They're having 3 IOX, and that's
Oh,
their
outstanding.
digital conference that they have.
Yeah.
So they have just been overwhelmingly supportive of me coming in and talking about how I've been able to use digital dentistry and 3D printing in my practice, and Pactent has been nothing but just kind and supportive in allowing me some flexibility and speaking about their wonderful line of resins and how I've been using them.
Yeah, that's great. And just real quick, the whole, digital dentistry put the lab out of business. Look at Glidewell. And
Oh yeah.
they're embracing of this and they just continue to grow and grow because they're supporting the profession in so many ways. And
Yeah.
I'm really grateful to them for that too.
Yeah. Yeah. Yeah.
All right. Well, thank you, Bianca. I appreciate it. It's
Thank
been
you,
wonderful.
John.
Everybody, this is the Technology Evangelist podcast. I'm Dr. John Fluke. I'm partnering with Medidenta on this project, and I am really, really grateful for their support. We'll see you next time. Thanks for watching.